Namah Shivaya. Welcome back. So today is the bonus lecture on antimicrobial resistance. Okay. So of course I know this is a very different topic from our course, but I think as a microbiologist, it's my responsibility to spread the awareness about the antimicrobial resistance, right? And it's a very important and interesting topic. So I think I you will enjoy this topic, right? And learn something from this. See, it's a very common nowadays that antimicrobial resistance coming in the people, right? And it was not common in the past. Right now it's so much common because we are abusing antibiotics, right? And if like I am a researcher, and when we to continue the research, we have to read so many research articles, and I read so many articles about this. And every second article is on the antimicrobial resistance, right? And first we will see what is antimicrobial resistance. Okay, I will tell you. So when you eat an antibiotic, okay, and one time you take, okay, and after that, after some time it stop working on you, it get the resistance, right? Like you are eating penicillin, okay, and after some time, the second time you're using it, it's not working because now you need a high dose or different kind of antibiotic, right? So how it happen, and why it is a issue, okay? um, so that because the thing is see, when you eat a antibiotic, okay, and it go into your system, it kill your good bacteria also, okay. Your immunity become weak because 80% of your immunity come from the bacteria in your gut, okay. And the thing is, like we talk about harmful bacteria, okay, like salmonella typhi, which cause the typhoid fever. And you are taking an antibiotic, doctor give you a course like for 5 days, okay, you have to take an antibiotic for 5 days. But you think you are so much intelligent, so much smart, and you take medicine for like 3 days and stop eating it, right? You do that, many people do that, right? Or he give you for 3 days and you stop eating after 1 day or 2 day because you think, okay, now I'm feeling better, now I don't have any fever, I don't feel any pain, right? And you stop eating. But what happened with the bacteria for which you eating the antibiotic, right? See, consider it's a bacteria, okay, it's a bacteria cell. And the antibiotic can attack a bacteria in many ways. It can attack its outer cell wall, which is called cell wall, outer wall, okay. It can attack on that and it puncture it, right? And the cell will rupture eventually, right? Or it can penetrate inside the bacterial cell wall and attack on the DNA of bacteria, right? So the thing is, when it is attacking, okay, on sometimes what happened, like you take up one antibiotic, it attack on the cell wall here at this position, okay. It attack, and this one antibiotic make a hole in the bacteria surface, okay. Then again one antibiotic come, again make another hole, understand? The doctor give you the course to kill all the bacteria, right? All the bacteria in your system, because bacteria multiply so much fast, like E. coli multiply in the only 20 minutes. From one it become the two cells, okay. So it doctor give you medicine to uh, um, kill the bacteria in the all, right, all population of bacteria which is harming you, right? But what you did, you stop eating, and now you are attacking the bacteria on the same place because its process is same, right? It if it is attacking cell wall, it will attack the cell wall only, right? If it is attacking DNA, it will attack the DNA only, but at the same place, because it need a receptor to attach, right? Like this is the antibiotic, this is the structure of antibiotic, and this is the structure on the surface of the bacterial cell wall. So it will hold like this, okay, and start attacking. But what happened when you stop eating the antibiotic and you didn't kill it completely, because it now it is weak. Okay, it's not causing the disease because its population is down very much, so it's not causing the disease, but it's not finished. It's not finished yet. Okay, you didn't kill it completely. And in this case, what happens that now we are evolving from millions of years, but with bacteria it don't happen. I don't know if you heard about mutation, but in bacteria mutation happen so much quickly. Mutation is something that change in your genetic information, change in your DNA. Okay, so it give you kind of a superpower. Okay, so in bacteria it happens so much fast. So now bacteria know that something is attacking its cell wall, if we say, and there is a receptor here that receiving the antibiotic. Okay, what bacteria will do, it will change the shape of the receptor. Before it was like this, now it is like this. You cannot attach it. The antibiotic, next time you will eat this antibiotic, same antibiotic, it will not find the attachment point. It will not find the receptor because it's not there now. Bacteria change it completely on its cell wall. Okay, same thing can be happen when it is attacking a DNA also. Okay, in DNA also there are many base pairs. Okay, from 4 base pairs they make a particular gene, one gene. Okay, so if I say it is your antibiotic is recognizing one a particular base pair. Okay, one a particular set of base pairs. Okay, and it want to attach there, but if bacteria know about this, it will change it eventually. If you are not finishing it, it will evolve every time. Okay, it will evolve every time. Why do you think that AIDS virus is impossible to cure? AIDS is impossible to cure, right? And AIDS virus is impossible right now to kill. Why? Because its ability to mutate. It mutates so much fast that medicine cannot attack it. Before it eliminates it completely, it mutates within the course only. Okay, so you can suppress the disease but cannot cure it in AIDS. Right now we suffer from the corona so much, right? They give the antiviral, make the virus, right? Virus is mutating every time now, right? See, you see new variants is coming of corona, right? So why it is happening? Same thing, mutation is happening because bacteria, virus, these are unicellular organism and they evolve so much fast, right? And nowadays antibiotic resistance is so much common, it can be scary also, because sometimes a bacterial cell can be resist to many antibiotics, not only single one. Okay, so you are like, suppose a person is in a hospital and doctors are trying every antibiotic and none is working on them. Why? Because he has the resistance gene. Okay, and now nothing can work against this antibiotic. You have to, in this case now you have to come with some new antibiotic for this person, and that is very hard to find. That's when somebody is resistant for many antibiotics, called superbug. This bacteria is called superbug. Okay, and this resistance is can be shared among the bacteria. Okay, so because bacteria share information with each other in the form of gene, so this is the resistance gene. Okay, bacteria will share its DNA, sorry, with other bacteria. Okay, it is a special DNA in bacteria, it's called plasmid. Okay, it will share this plasmid with other bacteria also, and now this resistance will come in this bacteria also, which was not resistance before. Okay, so it is a problem should be discussed. Okay, and it can become from many things, like you are not even eating the antibiotic. If I say you are eating chickens, everybody is eating chicken, they use so much antibiotics in chicken when they grow in the poultry farm, right? They do it in the farm, in the farm, that they use the antibiotic for animals like cow, like buffalo. So in their milk this resistance can come. because the use of so much antibiotics. Okay, so in first place, I will advise as a microbiologist, you shouldn't use antibiotic. But it's not like because if you're suffering so much and the disease is on its peak, that time you have to take antibiotic, right? And but if you are taking the antibiotic, you have to complete the course. If doctors say you to eat for 5 days, eat for 5 days. Okay, it will harm your gut bacteria, I agree, but at least it will killing the pathogenic bacteria also, right? So now what is the solution? If I say that you shouldn't eat antibiotic, the solution is eat the natural things, like eat the clove. Okay, clove has essential oil which has antibacterial and antifungal properties. It has essential oil eugenol. Okay, it is so much potent. Believe me, I have seen the results in my lab. Eat garlic. It has allicin, which is essential oil. Okay, same antifungal, antibacterial, and it is so much potent. Okay, so whenever you are fall ill, you can take 3 4 clove, put it inside your mouth. You should chew it. Okay, don't just engulf it. Chew it slowly. Okay, it is very healthy for your teeth also. They say, dentists say, when you have a pain in your teeth, put apply the oil of the clove, right? Clove oil they um, suggest. So it is very benefit for your teeth also, for teeth infection, right? Because from infection from your mouth can reach to your gut also, right? So eat this. Like you can eat paracetamol. Paracetamol is not an antibiotic. Okay, and with that you can eat clove or garlic. Okay, so I think I explained that problem and give you the solution also. So now it's up to you. Okay, so choose clove and garlic instead of antibiotics. Okay, Om Namah Shivaya. Take care.